If you're over 60, this might be the most important health message you'll hear this year. Because right now, millions of seniors are taking pills that were designed to protect the heart. But new research reveals, in some cases, these very same medicines might be doing the opposite. We're not talking about rare experimental drugs. We're talking about pills sitting in almost every medicine cabinet. The ones for pain, reflux, blood pressure, cholesterol, even diabetes. They seem harmless. They're prescribed every day. But leading cardiologists and heart surgeons are now warning, when these pills are taken for years without proper monitoring, they can slowly weaken the very organ they were meant to save. The danger? It's silent. Most people don't feel it happening. They notice fatigue, swelling, dizziness, or shortness of breath, and assume it's just part of getting older. But in many cases, it's not age, it's the medication itself. In this video, we'll uncover 7 common medicines that doctors say seniors should use with extra caution. Each one is backed by real medical research, and each carries hidden risks most people never hear about in the doctor's office. And here's the part you don't want to miss. Medicine number 6 and 7 are among the most prescribed drugs in the world. They're supposed to protect your heart, but the truth about what they can do, especially after age 60, may shock you. Stay with me, because understanding these 7 medicines could literally protect your next heartbeat. Number 1 medicine is acid reflux pills, the ones many people take every morning to stop heartburn or acidity. These include common names like omeprazole, pantoprazole, or esomeprazole. They're called proton pump inhibitors, or PPIs for short. Millions of people over 60 take them daily, often for years, believing they're harmless. But doctors now say that long-term use of these pills can do more harm than most people realize. You see, these medicines work by completely shutting down acid production in the stomach. That's good for quick relief, but your stomach acid isn't your enemy. It's actually essential. It helps you digest food, absorb key minerals, and even protect against harmful bacteria. When acid levels stay low for months or years, the body slowly begins to lose magnesium, calcium, and vitamin B12, nutrients your heart and muscles need to work properly. Low magnesium levels can trigger irregular heartbeats, palpitations, and even heart rhythm disorders. And when calcium absorption drops, bones become weaker and blood vessels stiffen, something every cardiologist tries to prevent. Heart surgeons warn that for older adults, especially those already on multiple medicines, PPIs can quietly increase the risk of fatigue, dizziness, and heart complications. The scary part is, most people don't notice any symptoms until something serious happens. Now, it doesn't mean these pills are bad. They're life-saving when used correctly and for short periods. The real problem starts when someone takes them every day for years without medical review, often just to avoid mild heartburn. That could be managed with simple lifestyle changes. So if you're over 60 and on reflux medicine, talk to your doctor about whether you still need it, or if there's a safer, lower-dose alternative. Sometimes, just adjusting your diet, avoiding late-night meals, and managing stress can reduce acid naturally, without long-term side effects. Remember, the goal isn't to stop your medicine suddenly. It's to make sure your heart and body aren't paying the hidden price of unnecessary medication. Number 2 medicine is painkillers. The common ones we all keep at home for headaches, joint pain, or body aches. They're called NSAIDs, or non-steroidal anti-inflammatory drugs. The most popular names are ibuprofen, naproxen, and diclofenac. These medicines are incredibly effective for short-term pain, and for years they've been trusted by millions of people. But here's what most people don't realize. After age 60, your body processes these painkillers very differently, and your heart feels the impact first. NSAIDs work by blocking certain enzymes that cause pain and inflammation. The problem is, those same enzymes also help protect your stomach lining and keep blood flowing properly through your kidneys and heart. When you block them for too long, blood pressure can rise. Your body starts retaining fluid, and your heart has to work harder to pump blood. That extra workload may not be a problem for a young, healthy person, but for someone over 60, especially with heart issues, it can slowly lead to high blood pressure, swelling in the legs, or even heart failure symptoms. Doctors often see patients who develop shortness of breath, fatigue, or ankle swelling, not realizing it's the painkillers, not just aging, behind those signs. And there's another hidden danger. NSAIDs can interfere with common heart medicines, especially blood thinners or certain blood pressure pills. This combination quietly increases the risk of bleeding or heart stress. Now, this doesn't mean you should never use painkillers. They're perfectly safe for occasional use. After all, nobody should live in pain. But long-term, daily use, especially without a doctor's supervision, can put unnecessary strain on the heart, kidneys, and stomach. If you're over 60, the smarter move is to explore safer pain options. Sometimes, a gentle pain relief cream, stretching routine, or physical therapy session can reduce chronic pain without hurting your heart. And if you must take a painkiller, use the lowest effective dose for the shortest time possible, and never mix them with alcohol or other over-the-counter pills without asking your doctor first. Because sometimes, what feels like a simple tablet for pain relief can quietly become the reason your heart feels weaker. Number 3. Medicine is diabetes drugs. The ones that help control blood sugar, but can sometimes put pressure on the heart if not used carefully. For many seniors, managing diabetes is a daily battle, and these medicines are a lifeline. But certain older types of diabetes drugs, especially a group known as thiazolidinediones, or TZDs for short, like rosiglitazone and pioglitazone, have raised serious concerns among heart specialists. These medicines help your body use insulin better, but one of their side effects is fluid retention. That means they can cause your body to hold extra water and salt. Over time, that extra fluid can increase blood volume, making the heart work harder, and sometimes leading to swelling in the ankles or shortness of breath. For someone over 60, especially with a weak heart or a history of heart failure, that extra load can quietly push the heart beyond its comfort zone. Many people notice their weight going up or feel more tired, but think it's just aging or diet, as not realizing their diabetes pill might be part of the reason. That's why doctors now carefully review which diabetes medicines are safest for seniors. There are newer, safer options available today. Medicines that not only lower blood sugar but also protect the heart, like SGLT2 inhibitors or GLP-1 agonists. If you've been on the same diabetes medication for many years, it's worth asking your doctor whether a modern alternative could be better for your heart health. And remember, no medicine can replace good daily habits. Eating balanced meals, staying active, and keeping your weight under control all help your heart and blood sugar at the same time. The key message is not to stop your medicine suddenly, but to make sure it's the right one for your age and your heart. Because what worked perfectly for you at 40 might not be the best choice at 65. Always keep communication open with your doctor, and never ignore early signs like swelling, shortness of breath, or rapid weight gain. They may be your body's way of saying your medicine needs a second look. Number 4 medicine is steroids, the pills many seniors take for arthritis, asthma, inflammation, or skin problems. Medicines like prednisone or methylprednisolone often bring quick relief. Pain eases, swelling goes down, and breathing becomes easier. But behind that short-term comfort hides a serious risk for the heart. Steroids cause the body to retain salt and water. That extra fluid doesn't just make your ankles swell. It forces your heart to pump harder every single day. Over time, this constant pressure thickens the heart muscle, stiffens the arteries, and quietly increases the risk of heart failure. Major study published in the British Medical Journal showed that long-term steroid users were nearly twice as likely to develop heart disease as those who didn't take them. Even short courses, sometimes just a few weeks, can raise blood pressure, trigger irregular heart rhythms, and cause dangerous spikes in blood sugar. For older adults, especially those already managing high blood pressure or diabetes, this combination can be dangerous. Many seniors start steroids for a short flare-up, but the prescriptions get repeated again and again, turning a short-term fix into a long-term threat. Doctors say the key is balance. If steroids are truly needed, use the lowest effective dose for the shortest time possible. Never stop suddenly, but always work with your doctor to taper safely. There are often safer alternatives available, like targeted physical therapy, anti-inflammatory diets, or non-steroidal medications that don't put as much strain on the heart. Simple lifestyle steps, such as gentle stretching, staying active, and maintaining a healthy weight, can also reduce inflammation naturally. The important message is this: what feels like fast relief can sometimes set the stage for long-term heart problems. Steroids may calm pain in the joints, but they can quietly inflame stress inside the arteries. So before refilling that prescription, it's worth asking your doctor, is this still the best choice for my heart? Because sometimes protecting your heart means saying no to the easy fix and yes to the safer path forward. Number 5, medicine is heart rhythm drugs. The pills that are supposed to keep your heartbeat steady, but in some cases can quietly make things worse. These medicines, like amiodarone and flecainide, are often prescribed to seniors with atrial fibrillation or other rhythm problems. They can be life-saving when used carefully, but dangerous if not closely monitored. Here's the hidden problem. Amiodarone works by slowing down the heart's electrical signals, but sometimes it slows them too much. That can cause extreme fatigue, dizziness, or even fainting. Over time, this medicine can also build up in the body's tissues, including the heart itself, the lungs, and even the thyroid, leading to side effects that don't always show up right away. Research published in the Journal of the American College of Cardiology found that seniors on long-term amiodarone therapy were more likely to develop heart block and worsening heart failure. Another drug, flecainide, can be especially risky for patients who have already had a heart attack or heart disease. In the famous cardiac arrhythmia suppression trial, scientists discovered something shocking. People taking certain rhythm drugs actually had more sudden deaths than those who didn't take them at all. That doesn't mean these medicines should never be used. For some patients, they're absolutely necessary and even life-saving. But the key is careful selection and close follow-up. Doctors today often recommend safer rhythm strategies, such as catheter ablation or newer medications with fewer side effects, especially for older adults. If you or someone takes these kinds of pills and often feels dizzy, overly tired, or short of breath, don't ignore it. It might not be aging. It might be your medication talking. The truth is simple. Even drugs made for the heart can harm the heart if the balance isn't right. That's why regular checkups, heart monitoring, and open communication with your cardiologist are so important. Because when it comes to heart rhythm, precision matters, and the wrong pill, even with the best intentions, can throw that rhythm dangerously off beat. Number 6 medicine is blood pressure pills, the very drugs that are supposed to protect the heart, yet in some older adults can quietly slow it down too much. We're talking about medicines like beta blockers and certain calcium channel blockers, commonly prescribed to control high blood pressure or protect the heart after a heart attack. Now, these pills have saved countless lives. They lower blood pressure, reduce strain on the heart, and prevent future heart problems. But for seniors, especially those over 60, the same pill that helped 10 years ago may now be doing more harm than good. Here's why. As we age, the heart naturally becomes a little weaker and slower. Beta blockers further reduce the heart rate to ease pressure, but sometimes that slowdown becomes too much. This can lead to dizziness, fatigue, shortness of breath, or even fainting spells. Many seniors assume these symptoms are just part of getting older, but often it's the medicine that's quietly behind it. Large study in the Journal of the American Medical Association found that older adults who took beta blockers after a heart attack but had no ongoing heart issues didn't live longer, yet they faced more side effects, like low heart rate and falls. Another analysis in the European Heart Journal revealed that frail seniors on beta blockers were at higher risk of developing heart failure compared to younger, stronger patients taking the same drug. Doctors now stress personalization. That means blood pressure pills shouldn't be one size fits all. Every patient's heart condition, age, and physical activity level must be considered. In many cases, simple lifestyle changes, walking daily, reducing salt, staying hydrated, and strengthening leg muscles can lower blood pressure naturally, without overslowing the heart. So if you feel tired or lightheaded while on blood pressure medicine, don't ignore it. Talk to your doctor about adjusting your dose or exploring safer alternatives. Because protecting your heart isn't just about lowering numbers on a blood pressure monitor. It's about keeping your energy, balance, and heartbeat strong every single day. Number 7 medicine is cholesterol pills, also known as statins. They're among the most prescribed drugs in the world. Names like atorvastatin, simvastatin, and rosuvastatin are in millions of medicine cabinets. They're designed to lower cholesterol and protect arteries. But here's the surprising truth. In some seniors, especially over 60, these pills can quietly weaken the very heart they're meant to protect. Statins work by blocking the liver's ability to produce cholesterol, but in doing so, they also block the same pathway the body uses to create coenzyme Q10, or CoQ10, a vital compound that every heart cell needs to generate energy. When CoQ10 levels drop, the heart muscle starts running on low fuel. That's when fatigue, weakness, and even heart failure can slowly creep in. A study in the American Journal of Cardiology found that long-term statin users had significantly reduced CoQ10 levels, leading to lower heart muscle performance. And while many people know statins can cause muscle pain or cramps, few realize that this muscle damage can, in rare cases, extend to the heart itself. The European Heart Journal reported that seniors with pre-existing frailty or muscle problems were especially vulnerable, experiencing reduced cardiac strength after years of statin use. On top of that, some studies in the BMJ showed that the actual benefit of statins for preventing heart attacks in older adults was often smaller than expected, while the side effects, like diabetes, muscle loss, and fatigue, were more common. Now, this doesn't mean statins are bad for everyone. For high-risk patients with blocked arteries or prior heart attacks, they can be life-saving. But for seniors with only mildly high cholesterol, the trade-off might not be worth it. The smart move? Never stop statins suddenly. Instead, talk to your doctor about checking your CoQ10 levels and possibly adding a supplement if needed. And always ask whether diet and exercise adjustments could give the same results naturally. The bottom line? What was meant to protect your heart might, over time, quietly drain its strength. So if you're over 60, it's time to make sure your cholesterol pill is still helping and not slowly hurting the most important muscle in your body.